Hi folks, it's Dr. Mike. We're back for the third point along our medical exercise specialist career success pathway, and that point is management. Now, you've laid the foundation by completing the MES course or another course out there that, as we said before, gave you a good understanding of clinical anatomy and pathology. You learned some medical exercise management techniques. You also learned how to communicate effectively with medical professionals. You also have taken a corrective exercise course. And then you took that information and you went out and you started to apply it by observing in a physical therapy or chiropractic clinic, by also starting to work with medically based clients and finding a mentor in the form of a medical exercise specialist, a physical therapist or a chiropractor or another medical professional to just give you some ideas and help you with some of the challenging cases. But also, hopefully you started participating in case conferencing where you're sharing challenging clients or challenging cases with other medical exercise professionals, which now takes us to point number 3, management. At this point, you now have a foundation, you have some skills, and you learn how to apply those skills safely and effectively at stage 2 here. Now in stage 3, you're looking at this idea of taking that information that you've learned, the skills you've learned, and applying them to the client and producing positive outcomes. So this is the management phase. At this point, your focus is on functional outcome measures, or more importantly, managing this client, utilizing exercise. That's your sole modality, utilizing exercise now to produce positive outcomes, such as lower levels of blood glucose, improved A1C values, improved range of motion, improved strength, things along those lines. Along with that, in this stage, you're now learning to write initial and discharge summaries. It becomes most important that as you're now building your practice and becoming more professional, you now have to communicate and document what you're doing with these clients. You now start writing progress reports where you're actually looking at your client, you complete an initial summary, and then on a 30-day interval, every time the client goes back to their doctor, therapist, or chiropractor, you now write a progress report. Folks, I can tell you, this is a courtesy on your part to actually provide the medical professional with this progress report, but this is probably the best piece of marketing you'll ever do to really stand out head and shoulders above other fitness professionals in your community. Along with that, as you're getting these management skills down pat, you also now should start doing research reviews where you're actually going out and looking at literature, particularly medically based literature, on various research components or research topics that relate to some of the different conditions you're seeing. You'll be surprised how much information is out there in the research that can be applied and help you better manage your clients beyond just simply exercise. Also, we spoke earlier in stage 2, the application stage, we talked about case conferencing. At this point, as you're spending more time, you're working with more clients, now maybe you present a difficult case or client to maybe a group of other medical exercise professionals and ask them their opinions. So it's not always asking someone to look at your client or you're sharing information. Now you're actually presenting to the group. So you're doing the full-blown presentation saying, here's what we saw at the beginning, here's what we've done along the way, here's where the client is now. Does anyone have any additional information that we'd be able to apply to this client? This makes a huge difference in your professional growth. And at this point, it's all about the management, not the exercise. I think this is probably one of the biggest things we're trying to get across is it's not about just simply the exercise. Oh, here's a rotator cuff client. Do these exercises. If you don't know why you're doing the exercise, you don't understand the underlying anatomy and pathology or the goals of the exercise, it's just simply applying exercise. And let me ask this. I know a lot of you out there deal with physicians, or you have clients that have physicians that just give them a pill, pat them on the head, and send them on their way. Now, just giving that pill without really understanding the reason why and the ramifications of it, or looking at alternatives or other options, you really don't feel good about that. But let me ask this. Is giving a client just simply a prepackaged exercise regime for a medical condition appropriate also? No, it's almost the same thing as that physician does. So it's not about the exercise, it's about the management, folks. And in this phase, it's really about, can you take the foundation that you learned, the knowledge you learned in the foundation, the ability to apply that information, the application stage, the skills you learn there, and now use those to produce an outcome for the client, a positive outcome. This is what management is about. And this is one of the key components in helping you build a strong practice. Now, at this point, at this stage, again, you've gone through the foundation stage, you've gone through the application stage, you've now gone through the management stage, which means you can work with any client that has a medical condition and produce a positive outcome for them. Now, think about it. For the medical student, they finish medical school, but that last few months of medical school, they're doing what are called clerkships. They're actually out on the floors in the hospitals, up on the services in the hospital, and they're working with the interns, they're working with the residents, they're working right there beside them, doing some of the more mundane tasks, but they're actually seeing what's going on. Then when they graduate, they now go into the hospital as an intern. This is where their management phase comes in. They're working long hours, but they're watching or seeing clients that walk in the emergency room, and they're following through the full cycle that they're in the hospital. And they're learning how to now apply the information they learned in medical school. They got that foundation in medical school, and now while they're in their internship, they're now learning how to manage this client to a positive outcome. Same thing here we're asking you to do as a medical exercise specialist, but it parallels what we're seeing with medical education. Which now takes us to our fourth point, and our fourth point along the way will be specialization. I know a lot of you want to learn about specialization, so come back for the next video, but if you have questions about this one, email me at drmike@postrehab.com. Thanks again.